Will GLP-1 agonist drugs like Ozempic make you blind and give you cancer? I'm Dr. Rawat, physician who also founded healthgroupcoaching.com, where I coach on lifestyle and dietary methods of losing weight sustainably and reversing metabolic disease. But I also prescribe GLP-1 agonist medication. So is there any truth to this? And should you be worried? To unravel this, let's head on to my website and to my blog. Now, one of the primary ways in which GLP-1 agonist medication work is by slowing down gastric emptying, reducing intestinal motility, which in turn make you feel full, and you can get nausea as a side effect. And that is by far the most common side effect. On the STEP program, which was semaglutide, Wegovy 2.4 milligrams for obesity, about 73% of participants reported some gastrointestinal symptoms compared to 47% on placebo. But severe events were quite rare, around 4%. We do find that over time, most of these do settle down on their own. In the Step 1 trial for semaglutide, Wegovy, as well as the Surmount 1 trial for tirzepatide, Zepbound, while these side effects were common, they only led to discontinuation in a small minority of participants. In the Pioneer program, which is oral semaglutide Rybelsus, nausea did occur in 10 to 20% of patients and diarrhea in 8 to 15%. But again, this was mostly mild and transient. In my clinic, there are certain things that I tend to do to try to minimize these effects. We get a lot of clients who are impatient with weight loss. They want to lose a large amount of weight really fast. And they even request titrating up dosage of medication faster than it is recommended. It is recommended you titrate the dose up every 4 weeks. But generally, that's not a good idea because these medicines do take 3 to 4 weeks to build up into your system, and all of these side effects do become evident at about 3 to 4 weeks. And so there is a danger if you try to titrate too fast, then you could get more side effects. Secondly, even though the drug manufacturers recommend that you should titrate up to the maximum dosage, that's not always required. We do have to use some common sense because there are certain dangers of losing weight too fast, as we will discuss as we go along in this video. Larger meals and fatty meals tend to make nausea worse, so it's best to avoid those kinds of meals. To avoid constipation, try to increase your fiber intake gradually. I do recommend about 20 to 40 grams of fiber per day, but be mindful if you suddenly increase your fiber intake, then you could get bloating and tummy cramps, so do it slowly. Stay hydrated. A lot of people, because they lose their appetite, they forget to drink water as well. It's really important to keep reminding yourself to drink. If you get dehydrated, then you will get constipated as well. Since GLP-1 slow down your gastric emptying, it's important to eat slowly. If you have the habit of eating fast, you will get more nausea when you eat fast on a GLP-1. And for the oral semaglutide, Rybelsus, the instructions are that you should take it with water 30 minutes in the morning before food, and it's important to do it exactly as the instructions say. Increased risk of gallstones is also a risk with GLP-1 agonist medication. Now, rapid weight loss due to any cause can cause gallstones, but because of gastric stasis, there may be some biliary stasis as well, and so it is possible that there may be an independent signal for increased risk of gallstones with GLP-1 agonist medication. It may be appropriate to do ultrasound scanning before starting this medication, particularly if the risk appears high or there is a prior history. Many patients tend to be worried about visual side effects, and in the SUSTAIN 6 study, semaglutide, Ozempic, Wegovy was associated with an increased risk of diabetic neuropathy related complications. This was in clients who already had diabetic retinopathy, and any sudden reduction in blood sugar, and this can be because of insulin as well, can lead to a sudden worsening of diabetic retinopathy, which again highlights the issue that don't try to increase doses radically. If you're getting a reasonable amount of weight loss, just keep doses steady and increase slowly. It may be worthwhile to get eye screening done if you haven't done so already if you're diabetic, and keep an eye on it perhaps a bit closer while you're losing weight. There are two contraindications for using GLP-1 agonist drugs, which are a history or family history of medullary carcinoma of the thyroid, which is actually a very rare form of thyroid cancer, or a family history or personal history of a syndrome called MEN2 syndrome. Again, very uncommon. These are both conditions that I as a physician, have never seen in clinic. There is no association between GLP-1 agonist medications and the more common types of thyroid cancer like papillary carcinoma of the thyroid. Of course, if you have any new symptoms, then you should seek advice from your doctor. In some cases, it may be appropriate to do ultrasound screening of the thyroid while you are doing a screening, say, of the gallbladder as well. If you have any nodules which need biopsying, it might be worthwhile to get all of that out of the way before you start this medication. It should be noted, however, that the correlation was seen in rodents or rats, and while they have GLP-1 receptors on their medullary cells in the thyroid, human beings don't have that. And so far, we haven't seen any association of increased risk of thyroid cancer with GLP-1 agonists. Whatever observational data has suggested a link up appears to be mostly because of increased surveillance, which is another reason why getting a scan done beforehand might be worthwhile, because if you pick it up later, it's very easy for you to jump to the conclusion that it was caused by a GLP-1 agonist, while it's really possible it could have been there all along, but you never screened for it. People do worry about excessive muscle loss on GLP-1 agonists. This is something I worry about as well. I feel that this can happen with GLP-1 agonists, just like it can happen with any other form of rapid weight loss, which is not really done in a very scientific fashion. Another similar situation would be with long water fasting. If any kind of weight loss treatment makes you fatigued, tired, lethargic, unable to go to the gym and lift weights, then you are likely to lose muscle as well as fat. If the doses of GLP-1 agonists are increased rapidly, it can lead to quite a lot of fatigue and tiredness, and again, those people are then less likely to go to the gym and lift weights. So it is again important. I know clients want to increase their doses really fast on these drugs. Some of them are paying out of pocket. They just want to get maximum bang for buck, but there are risks. You want to lose weight sustainably, but also have sufficient calorific intake that you have energy to be able to go to the gym 3 to 4 days a week and lift weights. You also want to have increased protein intake, particularly around those days. 1.2 to 1.6 grams per kilogram of ideal target weight, which is around 0.7 to 1 grams per pound of ideal target weight. Ensure you get your electrolytes in, get your hydration in. Hair loss can also happen with GLP-1 agonists, but this can happen with any kind of rapid weight loss, also with stress and nutritional deficiencies. Again, being in a low calorific state can lead to micronutrient deficiencies, lacks of minerals and vitamins, as well as lack of protein. And so on my coaching program at healthgroupcoaching.com, I do recommend on a stack of protein supplements, collagen, electrolytes, multivitamins, etc. to maintain your nutrition even despite being on low calories. Also, avoid rapid weight loss that can also lead to more hair loss. If you're someone already suffering from hair loss, then do check out my hair loss blog. I have a lot more detail on my dedicated blog on hair loss. There are some rare and serious side effects such as pancreatitis, kidney issues, and injection site reactions. And so it is important to keep a lookout for those kinds of symptoms. And this is one reason why I'm quite worried, frankly, about the rise of these online GLP-1 prescribing websites where you can send them a text message and they will send you a prescription after a few questionnaires are filled in. No face-to-face contact. People like those because they're relatively cheaper and you're just getting what you think you want, which is an injection to help you lose weight. But there is danger here. There are many potential side effects which can be managed as long as a physician is monitoring you, giving you sound advice, and not just helping you with the dosage and monitoring, but also advising you on any tests that you might want to do for screening, supplements, and other kinds of lifestyle dietary changes you want to make to prevent the kinds of issues you may see with rapid weight loss. For those of you who would like to read the studies, then I have put the links on the blog. If you would like coaching from me, then visit me on healthgroupcoaching.com. There is a client discovery form which you can fill in and find out if you're a good candidate for the program.